think we're good to go. We're starting. So we have with us our office doctor here in Dynacom. We have Mrs. Petraki, who is the most expert from anybody to give us a brief presentation about COVID. So I'm just pulling up your presentation, Mrs. Petraki. So just give me just a second. There you go. Just guys, I'm gonna skip the break because we're a little bit behind. So it's gonna be something like 20 minutes from Ms. Petraki and another 20 minutes from me. So I'll skip the break because we're a little bit lagging behind. And I could do the break, but I'm not doing this because there are people from Philippines watching us, and it's night for them over there. So it's I know it's a little bit tiring not to take a break, but I don't want to make people in Philippines, wait until 10 o'clock in the evening to do this. So let me here share my screen. Good to go, I think.
Yes, here I am.
Here you go. You see that? Okay.
Yeah, so changing this.
Sure, you can change this, yes.
Okay.
Okay, we're good to go.
Okay. It is an honor for me to be here speaking to such a huge audience, and I will do my best to share with you some information about this strange visitor that changed our lives. So our theme is management of COVID-19 transmission and infection in the marine environment. My name is Maria Petraki, and I am an internist, and my subspecialty is on intensive care unit. Is it okay?
Yeah, it's fine. Fine, don't worry.
Okay. It was about 9 months ago when a new virus named SARS-CoV-2 appeared in China and soon caused unique changes in everyday life. The initial reaction of many national lockdowns due to pandemic.
What I see.
Okay. Oops. Is it okay?
It is. Yes. Oh.
Right. Oh, no worries. I should not. Is it okay?
Yeah, it's fine. It's
okay.
Fine.
So the initial reaction was many national lockdowns due to the pandemic, but it has to proceed to measures of dealing with the virus itself, trying to invent new drugs or vaccines, and meanwhile measures to mitigate the risk of transmission. But what are the characteristics of this virus that make it so unique and dangerous? First of all, its novelty. A new virus that we have just started to investigate and to learn things about his life. How long is he alive on surfaces? How long he stays in air? What is the way of transmission? And very importantly, what are the long-term consequences for people infected? Second, it's a very infectious virus. And unfortunately, the asymptomatic carriers, the ones that do not express any medical symptoms, are responsible for the transmission of 75% of all cases. As a consequence, it's very difficult to protect ourselves since almost everyone is a possible transmitter. Third, it might be very dangerous and lethal once people with comorbidities are infected. Which are these people? It's people that are obese, or they have cardiovascular problems, they have renal problems or respiratory disease, or are immunosuppressed due to cancer or any other problems, or also are over 60 years old. And fourth, the more people are affected, the more difficult it becomes for a health system to cope with an enormous burden, because the more people are infected, the more likely for vulnerable people is to end up in an ICU. But can you imagine how many beds can an ICU can a country afford? But as we progress through the COVID COVID-19 pandemic, the economy has to go on. It is vital to keep trade moving and transportation to maintain their function. To do that, we must ensure that crew can embark and disembark safely and efficiently. Therefore, all health authorities, companies, and associations have to create tools to help ship operators manage cases on board and prevent virus transmission. But how can we do this? First of all, let's think what we can do before boarding on the ship. So pre-boarding screening is advised for all persons, seafarers, shore personnel, to identify any symptomatic individuals or those exposed to COVID-19. If any symptoms are identified, then the person should not travel and instead seek medical care. And how can we conduct this? First of all, surveillance can be conducted either by self-reporting or with visual observation and, of course, temperature measurement with non-touching thermometers. There is a questionnaire that we're giving to all persons coming on board, which asks questions about, within the past 40 days, have you experienced fever higher than 38 Celsius, or have you felt feverish, or did you have cough or breathing difficulties, or have you ever been in contact with someone with COVID-19? Have you been with 1 meter of distance of someone with COVID-19 for longer than 15 minutes? Or have you provided direct care for someone with COVID-19 without wearing the proper personal protective equipment? If the port for any pre-boarding screening activities is essential and should include the following questions. Now, if the port authorities implement pre-boarding screening or health monitoring or PCR test for COVID, then the results should be shared with the master or skipper to avoid any duplication of measures. That means waste of money and time. Once on board, what we can do? First of all, risk analysis. But when we say risk analysis, what do we mean? There are two potential types of exposure to COVID-19. First, it's the contact between shore personnel and crew members, and the second is the contact between crew members. Thinking of this analysis should be described areas of ship where interaction takes place only between crew members and those areas where crew may interact with shore personnel. But why do we manage this? It is important because by creating zones, which mean areas where someone could go according to his interactions, for example, zone 1, potentially contaminated zones, where someone suspected to have COVID, and these cases can be isolated, such as the ship, medical accommodation, if any present, and all other areas that are potentially contaminated and have not been disinfected. So this is zone 1. Zone 2 is where potentially crew members interact, like mess room, the bridge, control rooms, smoking rooms, or communal toilets or shared cabins. And then zone 3 is the zone or activities where crew interact with shore personnel. And at last, zone 4, zones where no interaction takes place, for example, the single cabins. The result of this analysis will assist in determining which type of personal protective equipment, like mask, medical, or fabric, should be used in each zone or during this activity. For example, in zone 1, do you remember? The zone 1 is where contaminated or possibly contaminated people are staying or interacting. There, all persons entering the isolation should wear medical masks and disinfect where exiting the area. Whereas in zone 2, fabric masks can be considered if a physical distance of 1 meter cannot be maintained. What are the preventive measures we can take? First of all, there are generally measures. All these measures are helping to minimize the number of non-crew members boarding the ship and ensure that shore personnel have moved only into authorized zones. What about hand hygiene? Hand washing facilities and dispensers for alcohol-based hand rub should be put in prominent places around the ship and be accessible to all staff and visitors. Physical distancing. Crew members must remain at least 1 meter apart from one another, and especially from shore personnel when coming on board. The use of masks. As I mentioned before, in possible contaminated zones, all people entering the area should wear a medical mask. But we have to know that the use of a mask alone is not sufficient to provide an adequate level of protection. Other measures, such as hand hygiene and physical distancing, should be applied. Now, the type of mask, medical or fabric, to be worn should be selected based on the level of the risk and, of course, on the availability of masks on board. Environmental measures. We know that respiratory secretions or droplets from a possible contaminated individual can contaminate surfaces and objects. Depending on the environment, if it's hot or if it's humid, and the type of the surface, the virus causing COVID-19 can be found for periods varying from hours to days on every object or surface. Therefore, facilities and quarters occupied by a possible or known patient should be cleaned and disinfected daily. How do we manage contacts? Suspected COVID-19 cases. Managing the first step for the crew member designated to take charge of medical care on board the ship is to determine whether the situation is serious and necessitates reaching out for immediate shoreside medical support and advice, or whether it can wait until the ship reaches the next port of call. Depending on this jurisdiction, the crew member is encouraged to ask for shoreside, telemedical, or radiomedical assistance. Once a suspected case is on board, the designated crew member should ensure that the patient self-monitors temperature, breathing, and cough. If things changes, such as fever more than 38 or more for more than 3 days, or has difficulty in breathing, or has a respiratory rate more than 20 times per minute, then the case moves to the level of severe and the patient should not be treated on board, but requires immediate shoreside medical facility. The decision about whether to monitor a patient on board or to transfer them immediately to a shoreside medical facility for further treatment should be made on a case-by-case basis. This decision will depend on the clinical presentation, the requirement for supportive care, for example, if they're going to need oxygen, the risk factor, and of course the condition on the ship. During the desembarkation of suspected cases, efforts should be made to minimize the exposure of other persons and environmental surfaces, and suspected cases should be provided with a medical mask to reduce the chance of transmission. At the same time, once a suspected case has been identified, contacts should be quarantined for 14 days from the last day they were exposed to the suspected case. It's very clear and timely, it's very clear now that everyone dealing with this situation understands that clear and timely communication between the ship owner and its agents, and shore-based organizations intending to board the ship is essential. Not to mention that the crew member designated to take charge of the medical care on board should be trained enough to care for patients, how to manage their contacts, and of course to protect himself at the same time. Additionally, crew members should be educated on the signs and symptoms of the COVID-19. That crew members should self-monitor, which are the management of fever, cough, respiratory system, and of course seek for medical advice, since the disease must be severe, may be severe among vulnerable groups. I have to remind you here which are the vulnerable group: people over 60 years old, obese people, people with cardiovascular problems, diabetes, or people that have autoimmune diseases. At the same time, this person has to keep on chasing measures such as hand hygiene, respiratory etiquette, and social distancing. Dear all, SARS-CoV-2 is a novel virus, but it is more likely that we will have to learn living with it instead of isolating ourselves. So what do we need to do? The same thing either on board or back home. Take care and don't forget social distancing, wear a mask when needed, and hand hygiene and disinfecting the surfaces and objects used by a COVID patient. Wishing you all calm seas and a wonderful blue in your life. Thank you.
Ms. Petraki, thank you so much. We have some questions for you. Just let me set them up. Here you go. Okay. So, question number 1. Well, we had some really important ones. On board, there's a question. We have two 40-liter bottles of oxygen for use in emergency. Do you think this is enough if more than one person is infected by COVID?
Once a person needs oxygen, it puts him in the situation of a more severe case, meaning that this person should not rather stay on board.
Should be evacuated.
Should be evacuated.
Okay.
So we need the oxygen just for the first 1-2 days until we reach the next port. We are not treating patients with COVID-19 on board if they need oxygen. These people might deteriorate very soon and they will definitely need a medical facility care.
Okay. The other one is, which is the best practice, putting on gloves all the time or sanitizing hands now and then?
Gloves are not helping you unless you are treating a person which is COVID-19 positive. Using hand hygiene with sanitizers or washing them with a disinfectant is the best practice for someone on board, unless we are treating patients which are COVID-19 positive. So please leave the gloves for person treating the patients,
Okay.
not for everyday life. It's better to wash hands all the time. And why is this? Because when you use the gloves, you forget what you have touched. You believe that yourself are sterilized, but it doesn't happen so. With your gloves, you can touch your face, and if the glove is infected, then the virus goes on the face and then very possibly causes more bad than good.
Okay.
So avoid the gloves and use the disinfectant. Disinfecting your hands for 20 seconds, this is the best practice.
Great, great. Another question, what is the minimum medicine should the vessel carry for treating a COVID patient?
Well, the question is, what medication do we need for COVID-19? I'm afraid this is a very difficult question because after 9 months for dealing with the virus, we haven't come across with any medication that can be given for asymptomatic carriers or for people COVID-19 that they have very mild symptoms. The important thing to give is painkillers to control the fever, and in my opinion, I would suggest for especially not very young people or people that they have some comorbidities, like they are obese or they have blood hypertension, to give tablets of an antibiotic, which is called Zithromax or azithromycin, 250 milligrams, twice a day for 3 days. And this is not a treatment. We have to make clear this. There is no treatment for COVID-19 when at home. You just monitor, follow up, but once on the ship, I suggest we take this antibiotic because it might prevent you from other possible infections on top of COVID-19, like another pneumonia. So yes, using a broad spectrum antibiotic like Zithromax or azithromycin is discussable.
Okay.
So there's you don't really need many medications for COVID-19. I believe that in every pharmacy on the ship, you have painkillers, you have paracetamol, and I think nowadays we have discussed with responsible people, let's have 6 tablets for every possible patient of azithromycin for this case.
Okay. Another question is, if someone is infected from COVID-19 and then recovers and gets healthy, is there any possibility that he will be reinfected again?
A few months ago, we believed that no, it's not possible to be infected again. But as time goes by, we have found out that, first of all, the immunity that a COVID-19 infection leaves to someone might not last longer than 4 to 5 months. So yes, there is a chance for someone to have an infection, to be infected again with the COVID-19. Of course, it's very, very difficult and extremely rare to be infected by the same type of virus that caused the first infection. But as time goes by, there's always a chance for a mutation of the virus. And this is something we don't know. We cannot tell which kind of virus has affected. This is the reason that even if someone has been infected, doesn't allow him to forget the preventive measures, because this is the way of preventing not only himself, but also the others of a possible infection.
Okay. Mostly during port stay, 1 or 2 representatives stay on board till we finish the operations. What routine should the crew members do? And most importantly, they share mushrooms with visitors at port. So what should they do after the meals?
The preventive measures we can take is just avoid close interaction between crew members and shore personnel. That's why we said that we have to separate zones on board. Zones used only by crew members and zones used by shore personnel, and where interaction takes place with crew members should be done wearing a mask all the time. So I believe, and we have all understand this, we don't have many weapons to deal with this virus. Just 3: wearing a mask, social distancing, and hand hygiene. Nowadays, we have found out that in a small community, people that were not infected with the virus were the ones wearing a mask and disinfecting their hands all the time.
Okay, the question that had to do with policy, with company policy, I think Ms. Petrakis is not the most appropriate person to answer. Keep them for the final version, or for the final session that we have on the 3rd day, when you will be talking to the safety department. Okay, because they are the responsible people. She is our doctor in office, so she would be able. I'm not going to ask them ask her that question because she wouldn't know what to answer. But we can keep this question, please. I'm talking about the guy who's asking about if we have policy of supplying on board pulse oximeter and stuff like that. Please keep this for Captain Michalopoulos in the last day, okay? I'm going to give a couple of questions more, and then we should move on. We are big fun here. We have a lot of
Yes,
questions.
yes, I can see. Very hot topic.
Obviously, because the COVID-19 is a hot topic. I have another question. How should they see set, the condition set, if any COVID is suspect found on board? What's happened with the air conditioning?
Well, as I said, the person that has been found COVID-19 positive or has a suspected case because you can't do a test on board should be in an isolated area and should wear a mask. So this is the only preventive measure we have. When I believe that we are doing a very often cleaning of the air condition, isn't it? They're using the filters and the stuff and for the air condition. I believe this happens on board, and although I know that this is a central mechanism using the air condition, isn't it? But we have found out that there's not such a contamination using the air condition if we wear a mask.
Okay. For the policy questions, I see if you go on your chat, Panagiotis Infandis, our safety superintendent, is already answering that. So please go to the chat, and he's already answering that. But you can also ask Captain Michalopoulos in the end. And any specific meal or fruits if someone is infected on board?
Not really. Everybody which is infected has to eat well, drink a lot of water, and eat everything that wants. Because one of the symptoms of COVID-19 is malaise. Somebody who has this infection is feeling very tired. Usually they have a loss of appetite. Yes, we have to push them. We have to give them whatever they want.
Okay.
It is important to keep a good food income. It's very important.
Okay, so I think that would be all. Mrs. Petraki, thank you so much for joining us.
Thank you. Thank you.
I think it was a hot topic, and everybody, you got a lot of questions. So
I hope that I helped at some point, because as I said, this virus is a novel one. We don't know many things.
Okay.
We are learning, and we have to do our best and try to take any kind of measures until most of the population of the earth gets immunity. How do we get immunity? Either by vaccination or either by getting this infection. Because the second one, getting this infection, is very dangerous. Let's hope for the vaccine to come.
okay.
Okay?
Thanks
Thank
a
you
lot.
so much.
Thank you.